Hello everyone, my name is Dagmar Štruncová. I'm Managing Director of Czech Republic, one of the PAN's national offices, and I will speak about the hospital food, and I will speak in Czech. So I will speak in Czech about that. So for you, you need the headphones, please use them. Tak já bych začala, ale musím toto.
Let me start. We have a presentation on hospital diet in the context of health and sustainability. I will present the theory and my colleague will follow up with the practical part and the Motol teaching hospital practice. Why is diet or nutrition important? I will be very fast. I know that chronic diseases stand behind majority of deaths. The figures are too high, and the risk factors responsible for these diseases can be influenced. It is smoking, unhealthy diet, low physical activity, and harmful use of alcohol. And we focus on the nutrition, and we want to inspire the healthcare professionals to share the information to their patients. WHO quotes a high figure. 80% of all heart diseases, strokes, diabetes mellitus second type can be influenced by change of diet. My colleague said that cardiovascular diseases are leading. They stand behind by almost half of all deaths in the Czech Republic. Health profile of the Czech Republic. Almost half of all deaths in the Czech Republic is attributable to behavioral risk factors. That is, the factors of behavior that can be influenced, food stands behind 23% of all deaths. We are above the EU average, that's 17%, followed by smoking. Nutritional guidelines were already presented. The trend is that even big multinational organizations do recommend to put emphasis on plant food, and the WHO it was all said, so I'm very, very fast. WHO supports plant food and whole grain food. I want to emphasize that the World Cancer Research Fund tables similar recommendations. Plus, we should limit consumption of red meat and processed meat products. Processed meat products are a carcinogen of the first grade, as well as smoking. We in hospitals don't give patients cigarettes, and we should not be giving them red meat as well, and we should not be offering them unhealthy food. We should inspire them rather than that. We should learn them how healthy looks like and how to prepare it. European Society of Cardiology 2021, they changed the recommendations. As you see, food should be based on plant. Hospitals should be a role model. This is what we want to be. In this study, we can see what was already said. That is, that the healthcare system not only contributes to the global warming, it should also bear the responsibility for resolving the problems of change of climate. And it's not only the change of climate, it's also the fact that we destroy our planet and that causes other health complications. And healthcare professionals and healthcare systems should be involved and engaged in the change. The carbon footprint of healthcare globally is up to almost 5%. too much. And the nutrition that is healthy for man is healthy for the planet. The environment-friendly diet is nutritious and healthy for us. So why don't we use this solution for both problems? Well, in foreign countries, let me mention the New York case. In 11 hospitals, they started to offer plant food, and patients were satisfied, 90% of patients. The cost of a diet unit has reduced, and they saved 36% of carbon emissions. Well, we have to educate the patients in the hospital. They get healthy food, they see how it looks like, they also improves their health outputs during hospitalization, and if they retain their healthy food habits, they reduce the risk of future hospitalizations. So we have to educate the patients. And Healthy Hospital Food Project is a project that is our project, and in its frame we cooperate with hospitals when giving information about plant food in the hospitals. Our long-term objectives include health and sustainability, both. So if you want to learn more about hospital food, why don't you join our Healthy Hospital Food Network on the PANCO platform, where we communicate with the multinational experts. The pilot phase included 4 hospitals, and the results were similar. Patients were satisfied. Depends on the hospital and food, but 3/4 of patients used to choose plant food. The food waste fault, as well as CO2 emissions, that also dropped. We are talking about 39,000 people in hospitals every day, I mean hospitalized patients, and the staff as well. So here the pilot projects include Havířov and Olomouc teaching hospitals that started to offer vegetarian food, and the food was nutritionally balanced. Let me now mention my study. We focus on patients' food. We change the food for 3 months. We have a randomized study. One group of patients gets a Mediterranean diet. The other one gets a vegetarian diet. And we measure CRP. We measure inflammations, chronic inflammations that is a cause of many diseases, and it increases the risk of cardiovascular complications. Patients have a nutritional therapist who takes them through the change. It is a 3 months change. It's not that long. The patients are willing to take it, and they can see the results. Patients who try this diet, can really execute the change because they have got the therapist at their disposal. And now I'll hand over to my colleague Miroslav Krotký. We launched a project in the teaching hospital Motol with the Rostlině NGO, and he'll tell us more about it. He is the head of the Motol Catering, Motol and Homolka Catering. Thank you very much for your attention.